Hello, and welcome to the Hot Seat series, brought to you by the Turing-Roche Strategic Partnership. Dive into the heart of health and data science with us as we spotlight researchers from our partnership. Before we get started, a little background on the partnership. Our 5-year strategic partnership is between the Alan Turing Institute, the UK's National Institute for Data Science and AI, and Roche, the global healthcare company. Our collaboration officially launched in June 2021. Our partnership North Star, which is our guiding aim for the 5-year collaboration, is to enable the generation of insights to better understand patient and disease heterogeneity and its relevance to clinical outcomes at an unprecedented level of precision in order to improve clinical care. Put simply, we're investigating why patients respond differently to treatment and why diseases manifest in different ways in different people. Our research is focused into 3 different research themes of structure missingness, predictive modeling, and multimodal analysis. To find out more, you can check out our webpage. The Hot Seat series will interview researchers from across our partnership and these research themes, aiming to give you accessible information on our research, whilst letting you get to know the researchers themselves in an entertaining way. Each video will consist of researchers teamed up to compete for points against other teams. Hello and welcome to the first edition of Hot Seat. My name is Vicky Hellon and I'm the Research Community Manager for the Turing-Roche Partnership. Today we're so excited to welcome Chris Banerji and Rohan Chakraborty, who are both theme leads within the partnership. And let's introduce the rules of the game. Hot Seat videos will feature Turing-Roche researchers teamed up to answer questions on partnership research and data science and AI in health more generally. After each answer, our researchers will be scored by our partnership judges, who will hold up an emoji. The smiling face is worth 1 point for a solid answer, the heart eyes emoji is worth 3 points for a great answer, and the heart emoji is 5 points for a standout insight. Whilst our researchers are scored individually throughout the game, their scores will be combined at the end, and this score will then compete against other teams in next editions of Hot Seat. So perhaps Rohan to go first.
Thanks, Vicky. I'm Rohan. I'm a computer scientist and information engineer. I work mostly with cancer imaging for early cancer diagnosis, radiology, and digital pathology. I'm interested in explainability, interpretability, and multimodality.
Thanks so much, Rohan. And Chris?
Hi, thanks, Vicky and Rohan. I'm Chris. So I'm another one of the theme leads on the Turing-Roche partnership, where I work similarly to Rohan across lots of different aspects of trying to overcome the barriers of translation of clinical AI. And I'm also a clinician, so I work 50% of my time here at the Turing and the other 50% as a histopathologist at University College London Hospitals.
Great, thanks so much, Chris. And now let's introduce our 3 judges from the Turing-Roche community. So Zeena, you're up first.
Hi everyone, I'm a PhD student at UCL and also a Turing-Roche community scholar. Looking forward to see what our contestants today are going to answer.
Thanks, Zeena. And Kuniko?
Hi everyone, I'm Kuniko Paxton, a PhD student in the School of Computer Science at the University of Bohol, and I'm also the community scholar. So yeah, thank you very much.
Thanks, Kuniko. And last but not least, Sarah.
Hey everyone, Sarah McGough. I'm an epidemiologist by training and a data scientist at Roche. My specialty is in disease modeling and forecasting, and I'm one of the scientific leads from the Roche side.
Great, thanks so much, Sarah. So with that, I think we can get started. So the first round today is called Less is More. And the first question we've got in this round is, please describe the Turing-Roche partnership in 5 words or less. So Chris, you are up first for this one.
Okay, so I would say, okay, open-science, it's 1 word, partnership for personalized medicine, 5 words.
Amazing. Thanks so much. Judges, can you hold up your votes for Chris?
Yay.
Perfect. And Rohan, could you describe the Turing-Roche partnership in 5 words or less?
I would say collaborative, collegiate, disruptive, translational, and impactful.
Oh, I liked that. Judges, can you please hold up your scores? Okay, moving to the next question in this round. Please explain personalized healthcare in 5 adjectives or less. So we'll flip the order for this one. So Rohan, I don't know if you want to go first.
Bespoke, precise, robust, multimodal, and transparent.
Great. Judges, can you hold up your votes for that one? Perfect. And Chris, please explain personalized healthcare in 5 adjectives or less.
He's used the best adjectives. So I would say, I think
This one is tricky.
it is difficult. So translational, bespoke,
Chris, we can definitely give you more time on this.
yeah, I've literally it's not
Don't feel on the spot if you.
I'm not a wordsmith. I am a mathematician.
I feel like we're like flying through it, so we've definitely got time if you want to sit and have a think.
I guess personalized healthcare is yeah, as I say, it's sort of like it's a bespoke, data-driven, translational solutions to heterogeneous patient populations. Yeah, those are my thoughts.
Slightly over the 5, but I think we'll let you off. So yeah, can we have the votes from the judges, please? Perfect. Thanks, judges. So we're now moving on to the second round, which is explain to me like I'm ... So the first question in this round is explain the partnership North Star to your uncle. So Chris, you're up first for this one. No word limit on this, so.
Well, I only have one uncle and he used to be head of respiratory medicine at Novartis, so it wouldn't be very difficult for me to explain the partnership to him. But I suppose if I were to explain what we're trying to do, it's taking all the data, the big data that's coming out of clinical medicine. So when you go into the hospital, if you get blood tests taken, if you have a doctor talk to you and take your history, if you have images done, so scans, MRIs, whatever, biopsies, anything like that, all that data comes to us and we analyze that data. And we try and use the sophisticated analysis of that data in order to understand the best treatment, not for a condition, but for a person. And that's kind of the goal of what we're trying to do, is to understand why different people respond to different treatments and develop the optimal treatment for that.
Thanks so much, Chris. Judges, your votes, please. Perfect. Thanks so much. And Rohan, you'll go at this one. Hopefully you have a less educated uncle.
Well, the North Star is the North Star, so it will slightly be a repeat of what Chris said, but I will go the other way around. So each patient is different, but a clinical decision system, whether it is AI-enabled or not, should be able to cater to the heterogeneous characteristics of these patients, instead of a one-size-fits-all approach. So the predictions, the personalized should be personalized, even when handling large amounts of different types of healthcare data that Chris mentioned. So the partnership between Turing and Roche seeks to develop dependable data science methods towards that kind of personalized predictions despite patient heterogeneity.
Thanks so much, Rohan. Judges, your scores. Thank you. Okay, and now we're moving on to the next question in this round, which is, please explain algorithmic explainability and fairness to a university student. So Rohan, we've got you up first for this one.
So algorithmic explainability would mean how an algorithm arrives at a decision, whether we can track that in a transparent way, and whether it is aligned with how a decision is taken by humans in that domain. So in healthcare, whether it's aligned to clinical decision systems. And there are different ways of doing it. One can look at the predictions themselves, whether they're interpretable and transparent, whether the model itself is transparent, or whether the data that is being used to train the model are being used in a transparent way, which brings us to fairness, because the data can have bias, and a model trained on that data will inherently have that bias unless taken care of. One example can be, again, in healthcare, whether the model works well across different patient demographics. Because the training data might be biased in favor of a certain patient demographic. For example, for skin cancer, most of the patients would be white patients. But it is not as if skin cancer doesn't happen among darker skinned patients. So it should work for both. So that's fairness. One example of fairness.
Thanks so much, Rohan. Judges, your scores. Lovely, thank you. And Chris, your take on explaining algorithmic explainability and fairness to a university student.
I guess explaining explainability sort of risks a bit of an infinite regress, but I'll sidestep trying to do that and instead talk about the importance of these two things, because I think Rohan explained the definitions of these terms really rigorously. So I guess as we're moving into a stage where tools such as artificial intelligence become more widespread in the community, there's a real risk that that if we don't understand exactly how these tools are making decisions, or if we're, as Rohan was highlighting, making decisions on the basis of these tools and they have biases that we're not aware of, this could lead to a lot of problems, particularly in clinical medicine. And there's sort of an emerging legal requirement that is coming out for sort of high-risk AI tools that is kind of exemplified in this EU AI Act that came out sort of in March of this year. And this sort of said for high-risk AI tools, you need certain human oversight measures to understand when the AI is performing in a fair way across society. So you can be able to then identify when it's not fair and therefore don't rely on it to make a decision. So this is really important in clinical medicine. If you, for instance, have a tool that is better for certain subsets of the population, is very, very good, and you can rely on it for them, but then it's not very reliable, it might make poor decisions in other subsets. And so you need some sort of human oversight measure to detect the fairness and when it's not there, so that you don't rely on the tool. And the same thing for explainability. You know, for instance, in medicine, as a clinician myself, you know, one of the things that I know other clinicians worry about with AI is medical legal ramifications of AI. And you know, ultimately, if you make a decision based on AI and you can't explain it, at some point there's going to be a decision where something goes wrong clinically, because you know medicine is you know, there's always a risk of error. And when that happens, if you've used AI and you can't justify why you've relied on that decision, it can become really thorny territory. So being able to explain the decisions that are made by AI will become extremely important for translating this technology from a medical legal standpoint. So that's my take on the importance of explainability and fairness.
Thanks so much, Chris. That was really helpful context. Judges, your scores, please. Lovely. Thanks, team. And that's it for the second round. And just before the final round, let's have a quick check-in on the scores. Although you're competing together as a team, your individual scores are currently Chris with 34 points and Rohan with 42 points, so slightly running away with it. But let's see how this changes in the final round. And now the final round is called Research Roundtable. This is a super round where the judges can vote with multiple emojis for even more points. So for your final points, please give an elevator pitch on your research to a general audience. And Chris, you're up first for this one.
Lucky me. So my research covers a number of different aspects, but at the heart of it is trying to overcome the barriers to translation, that is getting something from a research setting to a clinical practical setting for clinical AI as a technology. And there are lots and lots of barriers to that. And at the moment, I focus on 3 key areas. One is something that we call multimodal data integration. And this is taking all these different flavors of data that we have coming out of clinics. So, text-based data from your reports to, complex imaging data that you get from sort of MRIs or pathology images, and finding a way to harmonize these, get them all together, and have a technology that can learn from these various different data types to really assist clinical decision-making. Not replace it, but assist it. Because I truly believe that, though I don't see a time in the future where AI replaces clinicians, I do think that the clinician that works with AI will replace the clinician that doesn't. And so, having something that can supplement that is very helpful. The second area that I work on is uncertainty quantification, and this ties into fairness as we were talking about earlier. Having one of these human oversight measures to really understand when the AI can be relied upon, can be fair, and when it can't be. And then the third area that I'm very interested in is explainability, again, as we were talking about earlier. And this is, again, having some human oversight measures and some real technical understanding of how deep learning and these other sort of artificial intelligence techniques are actually able to take the data and give you an outcome. Because if we can't reason, we can't understand the reasoning behind how AI makes decisions, then we can never really truly get it into the clinic from a medical legal standpoint. So that's it. Hopefully we've arrived at the floor just in time and the doors open for the elevator.
Amazing. Thanks so much, Chris. Judges, can you give your scores for the super round? Oh, a good combo there. Perfect. Thanks so much. And Rohan, are you ready for your elevator pitch?
So from the application point of view, there is quite a bit of overlap with Chris, since we are in the same team after all. So I will contextualize it in the specific domain I work in, which is imaging, cancer imaging for particularly early cancer diagnosis. So use of AI, machine learning, computer vision tools towards that. So the main modalities would be radiology for detection, and then digital pathology for grading and subtyping. That is the type of cancer and the grade of it. Of course, then you can mix in different modalities, additional modalities like clinical features and omics to do further analysis like staging or survival prediction. So that's the sort of type of data I'm working with. Within that, I'm also interested, like Chris, in explainability, interpretability. So in this case, what it would relate to is, say, if we are predicting a certain cancer subtype to be the top prediction, can we also put in enough number of other possible subtypes to reach a certain level of confidence, so that it almost works as additional digital assistant to a pathologist and gives options to follow up on. So that is from the interpretability side. At the same time, for each of these predictions, we would like to know what kind of visual features in the cancer image that predictive model based that prediction on, and whether those features align with the clinical features that a pathologist would look at. So these kind of explainability and interpretability issues within cancer prediction. Yeah.
Thanks so much, Rohan. And judges, your final score on the doors for Rohan. Thank you. And that's it. So thank you so much for joining us today for our first edition of Hot Seat. Before we reveal the final scores, we really appreciate you taking part. So Chris, Rohan, how did you find the interview? What was the most challenging question?
Those five words questions are brutal.
Yeah, they were tricky.
If I'd been thinking about it, I would have just used ChatGPT to answer these ones.
Yeah, but we appreciated your honesty, Chris.
I'm grateful for that.
Comparatively, the descriptive ones are easier to answer. Yeah.
That's really interesting. Judges, did you have any comments on how our contestants did today?
I think we really gave them a 2-for-1 with those five words or less, because they were very similar. It was sort of like Rohan had already given 5 adjectives.
Yeah, it's very difficult
on the partnership, and then the partnership equals personalized medicine, and so to give 5 additional ones, I think that's a challenge for the thesaurus. But I think you guys did a great job, and I think it's really nice to be able to distill some of these really complex concepts for the audience, like algorithmic explainability and fairness, and sort of what you're doing in your research and what motivates you. So thank you for being our guinea pigs with this experiment.
Who came up with this? This is brilliant.
Kuniko.
Yeah,
it's good fun.
Yeah.
Okay, cool. Before I close this out, Kuniko, Zeena, did you want to add anything?
I was just gonna add that I think Rohan and Chris both did really well in terms of playing as a team. Although they have individual points, I thought they would like build on each other's answers, which is really good. Yeah, well done.
Good point.
That's what we do every day.
Yeah, that's what we do.
Yeah, Chris and Rohan, thank you very much. It was very fun, and yeah, excited to know how to say like the different type of way to describe research. Yeah, thank you very much.
Thank you.
That was a pleasure. Thank you. Yeah.
Okay, so final scores on the doors. Drum roll, please. So Chris, your total was 52. But slightly pipped by Rohan on 56.
Wow.
Pretty
very
just,
close,
pretty
though.
just.
No, I got to give it to him. Yeah.
So your team total is 108 points. So you'll be using
Out of how many?
That's a great question. So well done to both of you. Can our next team exceed this score, or will the theme leads win out? Thank you so much for watching. We hope this gave you an insight into the partnership research, and do join us next time for another edition of Hot Seat. Thanks and goodbye.
Thank you.
Thank you.